Your body is being treated right now, not healed. Treated. There is a very important difference between those two words, and understanding that difference might be the most important thing you do for your health this year. Every time you walk into a doctor's surgery with a complaint and walk out with a prescription, something specific is happening. A symptom is being suppressed, a number is being adjusted, a problem is being managed, but the reason that problem showed up in the first place, the actual root cause driving it, is almost never discussed. And in many cases, the treatment you're given makes that root cause worse over time. Modern medicine is genuinely extraordinary at emergency care. If you have a heart attack, a serious infection, or a broken bone, the system is built to save your life, and it does that job brilliantly. But when it comes to the chronic diseases that are slowly destroying the health of people in their 50s, 60s, and 70s, conditions like type 2 diabetes, high blood pressure, autoimmune disease, chronic inflammation, and metabolic dysfunction, the same system that can pull you back from the brink of death is remarkably poor at actually reversing the conditions that put you there. The problem is not bad doctors. Most doctors are incredibly dedicated and work within a system that was never designed to teach them what drives chronic disease at a biological level. The problem is a medical model that was built around treating symptoms rather than understanding why those symptoms appear. And that model, combined with an industry that profits from ongoing treatment rather than complete recovery, has created a hidden crisis that most people over 50 are living through right now without realizing it. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the AAND, I've seen what happens when preventable disease isn't prevented. I've seen patients in their 60s arriving with strokes, heart failure, and organ damage that built up silently over decades while they were taking medication and being told their numbers were fine. My goal now is to help people understand what's actually happening inside their bodies so they can avoid those outcomes in the first place and live longer, healthier lives. If you're watching this video, you're probably worried about your health or the health of someone you love. And I want to take a few seconds here to make you a direct promise. I promise to keep creating the most useful, research-grounded videos I possibly can. Videos that go deeper than what your GP has time to tell you in a 10-minute appointment. All I ask in return is that you give this channel a fair chance and hit the subscribe button. If you get to the end of this video and you feel like you haven't learned anything genuinely new, then feel free to unsubscribe. No hard feelings at all, but if you give me your time and attention, I'll give you everything I've learned from a decade on the front line of medicine. Please hit the subscribe button and help this channel reach more people like you, and let's get into it. To understand why modern medicine is making so many people sicker, you first need to understand what it was designed to do. The pharmaceutical model that dominates healthcare today was built in the early 20th century around one core idea: identify the pathogen or dysfunction causing a disease and find a chemical that suppresses it. This worked spectacularly well for acute infectious diseases. Antibiotics eliminated infections that had killed millions. Vaccines wiped out diseases that had devastated populations for centuries. The model was a genuine triumph. But then something shifted. As infections came under control, the dominant disease burden in wealthy countries moved away from acute infection and toward what we now call chronic metabolic disease, obesity, type 2 diabetes, hypertension, heart disease, autoimmune conditions, and neurological decline. And the medical system applied exactly the same model to these new problems. Identify a measurable dysfunction, find a drug that suppresses it, manage the number, declare the patient treated. The critical flaw in that approach is that chronic metabolic diseases are not caused by a single pathogen or a simple chemical deficiency. They are caused by a breakdown of biological systems, a collapse of the body's ability to regulate insulin, inflammation, cellular energy production, gut bacteria, and hormonal signaling. You cannot suppress your way back to health when the entire regulatory architecture of the body has gone wrong. But that is precisely what modern medicine keeps trying to do. There are three biological systems that sit at the root of almost every major chronic disease, and modern medicine's approach to all three follows the same pattern. Treat the output, ignore the input. Understanding these three systems is essential to understanding why so many people are getting worse despite treatment. The first system is insulin signaling. When cells stop responding to insulin properly, a state called insulin resistance, the pancreas compensates by producing more and more insulin to push glucose into cells. Chronically elevated insulin then drives fat storage, inflammation, high blood pressure, and eventually the cellular dysfunction that underlies type 2 diabetes. The conventional response is to lower blood sugar with medication. But lowering blood sugar while insulin remains chronically high is like mopping the floor while leaving the tap running. The driver of the problem is still fully operational. The second system is chronic inflammation. Inflammation is not inherently bad, it is the immune system's primary repair mechanism. Short-term, targeted inflammation heals tissue and fights infection. But when inflammation becomes chronic and systemic, when the immune system is in a constant low-level state of activation, it damages blood vessels, impairs brain function, disrupts hormonal signaling, and accelerates cellular aging. Research published in Nature Medicine has linked chronic systemic inflammation to cardiovascular disease, depression, Alzheimer's disease, and multiple cancers. The conventional response is anti-inflammatory medication, but these drugs suppress the immune response globally, which creates a new set of problems: increased infection risk, impaired healing, and in many cases, dependency. The third system is the gut microbiome. The trillions of bacteria living in your intestinal tract are not passive passengers. They regulate immune function, produce neurotransmitters, control inflammatory pathways, and influence how your body metabolizes food and medication. Research published in Cell has shown that the composition of the gut microbiome directly influences the risk of conditions ranging from type 2 diabetes to Parkinson's disease to clinical depression. Disrupting that ecosystem with repeated antibiotics, processed food, and chronic stress creates a cascade of downstream dysfunction that standard medicine has almost no tools to address. The microbiome is rarely even discussed in a standard clinical appointment. Words 1800, 2800, vertical bar, emotional peak. So let me name the core problem explicitly, because everything we've covered so far has been building toward this single uncomfortable truth. The hidden danger of modern medicine is not that doctors are incompetent or that treatments don't work in the short term. The hidden danger is that the system has been optimized to keep you in a managed state of illness rather than return you to actual health. And it does this not through malice, but through structural incentives that most patients never see. Here is how the trap works in practice. You develop high blood pressure in your early 50s. Your GP checks the number, it's above the target, and you're prescribed an antihypertensive. The drug brings the number down. Your GP is satisfied. You're told you're being managed appropriately, but no one asks why your blood pressure went up in the first place. No one investigates whether you have insulin resistance, chronic inflammation, poor sleep, a damaged microbiome, or a diet that is chronically driving your vascular system into a high-pressure state. The drug treats the output, the inputs are never addressed, and over the next decade, while your blood pressure number stays controlled on paper, the underlying metabolic dysfunction that caused it continues to progress. You develop another condition, you receive another drug. The cycle continues. This shows up in several specific ways that will be painfully familiar to anyone in their 50s or 60s. The most obvious is the polypharmacy trap, being prescribed multiple medications where each new drug is managing a side effect or downstream consequence of the previous one. A statin for cholesterol leads to muscle pain, which leads to a muscle relaxant, which leads to fatigue, which leads to a recommendation to rest more, which worsens insulin resistance, which elevates blood pressure, which requires a second antihypertensive. At no point does anyone ask whether the original statin was the right intervention or whether the cholesterol elevation itself was a symptom of a correctable metabolic problem. The less obvious version is annual blood test misinterpretation. You go for your annual checkup, your results come back within the reference ranges, and your GP tells you everything looks fine. What most patients don't know is that the reference ranges used to define normal are based on population averages, And when the majority of the population is metabolically compromised, average and healthy are not the same thing. You can have insulin levels that indicate significant insulin resistance, inflammatory markers that signal ongoing vascular damage, and microbiome indicators of serious gut dysfunction, and still fall within normal reference ranges, because normal has been redefined by the population's declining baseline. Then there's the category of treatments that damage the systems they're supposed to protect. Proton pump inhibitors, the drugs prescribed for acid reflux and stomach ulcers, are among the most commonly prescribed medications in the world. Research published in Gut has shown that long-term use significantly disrupts the gut microbiome, reducing the diversity of bacterial species and increasing the risk of intestinal infections. The same drugs that are prescribed to protect the stomach lining are simultaneously damaging the bacterial ecosystem that regulates immune function, inflammation, and nutritional absorption. If you are living with one or more chronic conditions and feel like you're doing everything your doctors have told you to do without getting meaningfully better, that is not a failure of willpower or effort. Chronic disease doesn't persist because patients are non-compliant. It persists when the system managing that disease was never designed to address the biological mechanisms driving it. You were told to manage your numbers. Nobody told you how to restore the systems that generated those numbers in the first place. That is a failure of the model, not of the person inside it. If you're finding this valuable so far, please take a second and hit the subscribe button. It genuinely helps these videos reach more people who need to hear this. Now let's talk about what actually works. Words 2800 4200 vertical bar, empowering and I want to frame this carefully before we go any further. I am not suggesting that you stop taking any medication without discussing it with your doctor. That is not safe, and it is not what this video is about. What I am saying is that medication and genuine metabolic recovery are not mutually exclusive. They work far better together, and if you have been on medication for years without actually improving, the following may be the missing piece of the equation that nobody has explained to you. Biological restoration works through 4 primary levers. Each one addresses a root driver that symptom management alone never touches. Insulin resistance sits at the foundation of the majority of chronic diseases affecting people over 50. Reversing it does not require a dramatic dietary overhaul. It requires reducing the signals that keep insulin chronically elevated. The single most effective dietary intervention for this is not cutting fat or counting calories. It is reducing the frequency and quantity of refined carbohydrates, particularly ultra-processed foods that cause rapid and sustained glucose spikes. Research published in the New England Journal of Medicine demonstrated that dietary patterns centered on whole foods, fiber, and reduced refined carbohydrate intake consistently improved insulin sensitivity within 8 to 12 weeks. When insulin comes down and stays down for extended periods, the kidneys begin releasing sodium appropriately, blood pressure often drops, and the systemic inflammatory cascade associated with insulin resistance begins to resolve. Everything connected to insulin starts to improve simultaneously. Chronic inflammation does not respond well to anti-inflammatory drugs in the long term because those drugs suppress the immune response globally rather than removing the triggers driving the inflammation. The most powerful triggers of chronic systemic inflammation are ultra-processed food, chronic sleep deprivation, unmanaged psychological stress, and gut dysbiosis, an imbalanced microbiome. Each of these is addressable without a prescription. Prioritizing 7 to 8 hours of sleep per night reduces the production of inflammatory cytokines, the signaling proteins that maintain the inflammatory state more reliably than most anti-inflammatory supplements. Research published in Science has shown that even a single night of poor sleep produces measurable increases in inflammatory markers in healthy adults. This is why sleep is not optional. It is a primary biological repair window, and consistently cutting it short means the inflammatory damage of the previous day never fully resolves. The gut microbiome is rebuilt through consistent exposure to the right inputs over months, not days. The most evidence-supported approach is straightforward. Increase dietary fiber from diverse whole food sources, reduce ultra-processed food consumption, and where possible, avoid unnecessary antibiotic courses. Research published in Cell Host and Microbe demonstrated that a diet high in diverse plant-based fiber sources increased microbiome diversity significantly within 6 weeks, with corresponding improvements in inflammatory markers and gut barrier function. Fermented foods, plain yogurt, kefir, sauerkraut, kimchi provide direct microbial inputs that support bacterial diversity. This is not about buying expensive probiotic supplements. It is about consistently feeding the ecosystem that already exists inside you. Exercise is the most underutilized drug in chronic disease management, and the mechanism that makes it so powerful is almost never explained to patients. When you perform aerobic exercise, the mechanical stress on your blood vessel walls stimulates the endothelium, the inner lining of every artery in your body, to produce nitric oxide. Nitric oxide is a signaling molecule that causes blood vessels to relax and dilate, reducing vascular resistance and blood pressure. This effect persists for hours after the exercise ends, which is why regular movement creates sustained improvements in cardiovascular health that no single medication can fully replicate. Beyond vascular effects, regular physical movement dramatically improves insulin sensitivity by increasing the number and efficiency of glucose transporters in muscle tissue. Research published in Diabetologia has shown that as little as 30 minutes of moderate intensity walking 5 days per week produces clinically significant improvements in insulin sensitivity within 4 weeks. The muscle is the largest glucose sink in the body. When it becomes more efficient at absorbing glucose, the pressure on the pancreas to produce excess insulin drops, and the entire downstream metabolic cascade begins to improve. I want to be direct about this. If you're on medication for blood pressure, blood sugar, or cholesterol, these interventions are not a reason to stop it. They are a reason to go back to your doctor in 3 to 6 months with genuinely improved metabolic markers and have an honest conversation about whether the dose or the drug itself still makes sense at the level it was prescribed. Many patients who address root causes through the mechanisms above find that medication needs to be reduced rather than eliminated. That is a conversation between you and a clinician who knows your full medical history. But it is a conversation worth having. Let me bring this back to what I actually see, because I think real clinical experience grounds the physiology in a way that statistics alone cannot. In emergency medicine, you meet people at the end of a long process. By the time someone arrives in the AANDE with a hypertensive crisis, a diabetic emergency, or early-stage heart failure, there has usually been a decade of managed illness preceding that moment. The numbers were controlled, the prescription was filled, the annual review said everything was fine, but the underlying system had been deteriorating the entire time because the underlying system was never actually addressed. What I've observed repeatedly in patients who do change course, who reduce ultra-processed food, prioritize sleep, move consistently, and work with a doctor willing to measure root cause markers rather than just output numbers, is that the improvement timeline is far shorter than most people expect. Insulin markers begin shifting within weeks. Blood pressure often responds within 1 to 3 months without medication changes. Inflammatory markers measurably improve within 6 to 12 weeks of dietary change. The body wants to return to regulation. It just needs the inputs that allow it to do so. The patients who struggle are not the ones who fail to try. They are the ones who are embedded in a system that only measures whether the treated numbers are acceptable and never asks whether the person behind those numbers is actually getting healthier. That distinction between treating a number and restoring a person is the most important clinical distinction there is, and it is one the current system is structurally built to ignore. Modern medicine is not the enemy. Let me be absolutely clear about that. The emergency care system, surgical technology, and pharmacological advances of the past century represent one of the greatest achievements in human history. If you have a serious acute illness, the system will save your life, and it will do so with remarkable competence and dedication. The problem is that the same system has been asked to manage a chronic disease epidemic that it was never designed to address. And rather than acknowledging that limitation and evolving, it has largely continued applying the same tools, suppress the symptom, manage the number, maintain the prescription to a fundamentally different category of problem, the consequences of that mismatch are playing out across every developed country in the world. More people are living with chronic conditions than at any point in recorded history. More people are on more medications, and more people, despite being treated, are not recovering. Understanding how that system works and where its limitations lie is not a fringe view. It is the next frontier of evidence-based medicine. An increasing number of clinicians, researchers, and medical institutions are now focused on what is being called root cause medicine or metabolic health medicine, an approach that measures and addresses the biological systems driving chronic disease rather than simply managing their downstream outputs. This is not alternative medicine, it is medicine asking harder questions. And the reason I make these videos is because most people do not hear those harder questions in a 10-minute GP appointment. They walk out with a prescription, a follow-up date, and very little understanding of what is actually happening inside their body or what they could do about it. That information asymmetry is not acceptable. You deserve to understand your own biology, and you deserve to know that in many cases, genuine improvement is not only possible, it is biologically predictable given the right conditions. That is what I intend to keep explaining as clearly and as honestly as I can for as long as this channel exists.